Hello, students. Today we're going to talk about the oral cavity, and what we're going to do is we're going to be dividing this information into three specific videos. So make sure that you're watching the second part and the third part. So we are going to go over the oral cavity, boundaries, communications. We're going to talk about the palate, the location, action, nerve supply of the muscles in the soft palate. We're also going to talk about blood supply and sensory innervation. And then in the next video, we're going to talk about the tongue and its anatomical features. And then after that, we're going to go over some other special sensory innervations, submandibular glands, etc. So we are going to start first with the oral cavity. I just moved myself to the side so that you guys can see uh, the information. So in general, the oral cavity is just this portal of the digestive system that allows us to do two functions generally. So obviously eat and drink, and also it allows us to help with respiration as well, supplementary speaking. So it extends from the lips anteriorly, so you can see on this picture right here, to the oropharyngeal isthmus, which is more posterior. I have it on this other picture. You can see it if you in this imaginary picture. So it's divided into two parts, a vestibule and an oral cavity. So for the vestibule, you have to imagine, I'll show you in another picture, but in the vestibule, this is a space in between the lips and the cheeks externally, and the teeth and the gingiva more internally. I'm going to show you a picture now so that you can observe, and I'm going to move myself again to the other side. So you can see here the teeth more anteriorly, and the cheeks more laterally, right? And so in this particular case, I'm also showing you now the oral cavity itself. And the oral cavity, the boundaries more anteriorly and laterally is the teeth and gingiva. And then posteriorly is the space between the right and left palatoglossal arches, which in this picture, you can see it right here from a sagittal angle or sagittal view. You can see the palatoglossal arch more posteriorly. And then in this picture below, you can see it from a superior angle. You can see those palatoglossal arches more posteriorly. Superiorly, you have the palate, which is essentially this area right here. And then inferiorly, you have the mylohyoid muscles, which would be over here more inferiorly if you think about if you consider your own face, right? Now, the palate, since I already mentioned the palate has two areas or two parts. There's a hard palate, which is the more anterior two-thirds of the palate, and there's a soft palate, which is the more posterior one-third. The hard palate is mainly formed by the palatine processes of the maxilla. And so you can see right here in this picture from an inferior angle of that superior area of the palate. And then also the horizontal plates of the palatine bone. So here you can see in green the horizontal plates of the palatine bones. Now on the soft palate, I'm going to go back in a second to show you. But the soft palate, it's like I said, more posterior, suspended from the posterior border of the hard palate, has no bony skeleton. So this is just a fold of mucosa, and it has also muscles, vessels, lymphoid tissue, nerves, and glands in that area. And so if I go to this picture that I just showed you, here you can see that soft palate terminating in the structure that we call the uvula. So for the palate continuation here, it has, like I said, it has a posterior border, that continuation, and on the posterior side, more of a free border. This is what we call the uvula, like you just saw. I'm going to show you another picture. Here you can see it from an anterior angle. So that's the uvula. And so on each side, you're going to have the soft palate becomes more like two arches or folds, and so this is what we call the palatoglossal arch and the palatopharyngeal arch. So that makes a little bit more sense as to what I was trying to explain earlier in this presentation. And so the palatoglossal arch, it's located more anteriorly, extending from the soft palate to the side of the tongue, covering the palatoglossus muscle, and the palatopharyngeal arch is located more posteriorly, which extends from the soft palate to the pharyngeal wall, covering the palatopharyngeus muscle. Now, in this picture, you can observe that those palatopharyngeal arches and the palatoglossal arch more laterally. Um, in this picture, you can see it's another sagittal sectioning. I'm going to move myself to the other side so you can see. Here you can see, again, from a lateral perspective, this is the soft palate terminating in the uvula. So one of the things that I mentioned so far is muscles, right? We have a couple of muscles on this area. One of the most prominent or most important, not prominent, but most important muscles is going to be the levator veli palatini. Because this muscle is located under the mucosa of the nasopharynx, just inferior to the pharyngeal opening of the auditory tube, creating more of a mucosal elevation known as the torus levatorus. And the action, as the name implies, is to elevate the soft palate to separate the nasopharynx from the oropharynx. Very, very important during the process of swallowing to prevent the passage of food into the nasopharynx and the nasal cavity. And then we have another muscle, very important, called the tensor veli palatini. So I'm going to show you the muscles real quickly. Here's tensor veli palatini muscle and tendon, and here's levator veli palatini, which I already described. So the tensor veli palatini, this one is more anteriorly and slightly lateral to the levator veli palatini, as you saw on that picture, on this picture over here. And its tendon is going to curve around the pterygoid, what we call the pterygoid hamulus, and becomes continuous with this palatine aponeurosis. Anyways, the most important thing is the action, and the action is to tense the soft palate, and it opens the pharyngeal opening of the auditory tube. If you notice over here, this is where we have, it's a cartilage that's continuous with the auditory tube. And if you, I don't know if you've ever seen this before, we're going to talk about it in another video, but the auditory tube is also known as eustachian or pharyngotympanic tube. This is a structure that connects your pharynx with your middle ear, all right? So that's the importance of this structure. Now, other muscles of the soft palate that we can find is the palatoglossus, the palatopharyngeus muscle, and the musculus uvula. Out of those three muscles, they're all important. They're all located within either the palatoglossal arch or within the palatopharyngeal arch, with also purposes of elevating parts of the pharynx during swallowing or depressing the soft palate, etc. Now, another muscle that we have is the musculus uvula. This one's located in the midline, inserting into the mucosa of the uvula, and it shortens the uvula and pulls it more superiorly. So if I show you a picture, this is the same muscles that I was just talking about, but from a posterior view. This is tensor veli palatini here, and levator veli palatini. I'm not sure that I have a picture of the actual muscle, but here, if this is the uvula, this is where, on the inside is where you're going to find, deep to the tissue, it's where you're going to find the musculus uvula. Now, some of the nerves and arteries of the palate, remember, this is super important. Motor innervation for tensor veli palatini, it's by the mandibular nerve, or V3. But all the other muscles are going to be supplied by the vagus nerve. So there we have one important variation in terms of the nerves that we need to pay attention to. And then the sensory innervation for this is going to be the greater and lesser palatine nerves, nasopalatine nerve, and tonsillar branches of the glossopharyngeal nerve. Super important, the difference between motor versus sensory. Now the arteries on this area, I'm going to show you a picture here, but I want to go back to the information. It's the greater and lesser palatine arteries. These are direct branches from the maxillary artery and palatine branches of facial and ascending pharyngeal arteries. So greater and lesser palatine arteries, important, as well as palatine branches of facial and ascending pharyngeal arteries. So here you can see greater palatine artery and lesser palatine arteries supplying this region. Now, one important clinical correlation that I wanted to mention, I'm just going to make myself a little bit transparent behind this information, but it's tonsillitis, because in this region we do have tonsils. These are part of your immune system with the purpose of, well, hosting a lot of immune cells. So whenever we are sick, they can immediately start working with that process. So one thing that we can observe in this area, very common, it's inflamed tonsils, also known as tonsillitis, right? Inflammation of the palatine tonsils due to different causes. Nasal congestion can cause this, headache, fevers, and cough. But one of the most typical causes for inflamed tonsils, it's going to be viruses such as the flu or mononucleosis, right, from that Epstein-Barr virus, or very common also bacterial infections such as streptococcus, what we call AKA strep throat. In those, you would definitely see the tonsils with these white spots of pus. And so that's essentially one of the main indicators for strep throat. And then it can be preceded by pharyngitis. Okay, so on the next video, we're going to talk about the tongue, and I'll see you on that video.